Yes, so I am not Tao, but I am possibly the next best thing. My name is Arjun Iyer. I am an emergency physician, been in practice about 2 years, but been working with ScholarRx for, oh goodness, 8 years, 7 or 8 years by this point. Probably if you know of me, you probably know of me as a First Aid Express author, but for the last 2.5 years, I've been the Director of Multimedia in Medical Education for ScholarRx, developing the audio and video products. And with me today, I've got two panelists, Brenda Variano and Brian Smith. Brenda, would you like to introduce yourself?
Sure. Hi, everyone. Just like Arjun, I am not Tao Lee, but I am Brenda Variano. I am a third-year medical student at Central Michigan University. I wrote my Step 1 this past summer, and I used a lot of the RX tools, and I'm now currently an RX coach. So hopefully I can coach some of you guys one day and also help answer some questions during this webinar.
Very cool. And what about you, Brian?
Hey, good evening, everyone. My name is Brian Smith. I'm a current ophthalmology resident at the Philadelphia College of Osteopathic Medicine in Philadelphia, Pennsylvania. And I am an RX coach as well. So I work one-on-one with students just like yourself to help you guys crush the USMLE Step 1, Step 2 CK, as well as the complex exams. And I'll be helping answer questions in the question box tonight, so feel free to ask away.
All right. Well, so these two will provide a little bit of a fresher perspective. As I am increasingly becoming aware, I'm getting older, and Step 1, the stress and the misery of occasional misery of stressing about Step 1 is sort of fading to a blissfully vague memory for me. So these two are going to help me keep it real. That being said, though, the first step is relax. Take a deep breath. For one, the test is going pass-fail. That does take a bit of the burden off of your shoulders. That does not, however, take away the responsibility to become a smart doctor. Remember, the stuff that they're testing you on for Step 1, I mean, it's not like the SAT or MCAT anymore, where it's all just nonsense that you're never going to have to use ever again. These questions are actually, for the most part, phrased in terms of multi-part vignettes that mimic clinical reasoning. So these are important skills and important knowledge for you to build, even if it's not something you use in your immediate practice. I mean, what differentiates an NP from a doctor? Because NPs honestly can probably handle about 80% of the cases that doctors can in the emergency department where I work, simply by pattern recognition and accumulated experience. But it's for those 20% of cases that require a little bit more lateral thinking, a little bit deeper of a fund of knowledge to say, this isn't exactly how the textbook presents it. What am I missing? What's different? And that is what really, in my opinion, makes a physician and gives us our added value. So you do have a responsibility at this time to kind of build your fund of knowledge, and honestly, the privilege of doing so. I'm personally a huge nerd and like to learn, so that's my perspective. But I think it's a good mentality and mindset to go into this with. See it as an opportunity, not as a stress. So here's kind of the overview of what we'll be talking about. We'll be going over the basics, talking about defining your goals, giving some updates on the USMLE, and talking about some timelines for study, how to approach each subject, choosing your test prep resources, hint, the answer is choose us, more study tips, RX Coach and RX Bricks updates, and the raffle and special offer. Jeff, if I don't remember about this, you got to remind me. And then we're going to open this up for discussion. So here's the basics. It's probably not new knowledge to most of you. It is an 8-hour test. There are 280 questions in 7 one-hour blocks. That's 40 questions per block and 40 minutes of break time. And you can scatter this break time in between sections however you like. This is probably something that is worth a little bit of practice and thought. How do you like to break up your blocks? Multiple little ones or one big long real break? Personally, I always like to, take a little stretch break in between every section or other section. I don't know. When I'm working, I like to take an actual break, but when during test day, all 45 minutes is going to do is give me 45 minutes of time to like stress over the questions I might or might not have gotten right. I don't know. What are you guys' opinions, Brenda, Brian?
Yeah, so I think for everyone, it could be a little different. I think that a good way to do it, depending on what test you're taking, would be every 2 blocks, or at least be able to do 2 blocks in a row. But personally, I like to take a short little stretch break between each section when I could.
I'm the same way. I kind of like the little break in between to reset, because you don't know what you're going to get in the next block. I remember sometimes one block would just have a ton of long questions, and had I not taken a break, that would have been draining. I love exercising, so I would take a 5-minute break in between each block and do lunges, sprint down the hall, just to give myself some energy. So everyone's different.
I also drink way too much coffee, so the pee breaks were necessary for me. All right. That's some good insight, guys. So how are the questions going to be structured? So take this question, for example. A 32-year-old woman presents with a 5-day history of occasional double vision and bilateral ptosis. What is the most appropriate diagnostic test? So that most appropriate right there, that is what you can expect from this test. They're going to be asking you for the best answer, not the only answer, not, what would you do in a certain clinical scenario. Let's say if you had all the resources in the world and you had to pick one of these 5 options, what option do you pick? So, for example, this 32-year-old woman with the 5-day history of double vision and bilateral ptosis, what does she have? What do you think she has based on only that information? Type it in the box. Is there a chat box they can type in?
Yeah, they can go to the question box and.
Okay, I see it. All right. We got Joy Dika on point. Yeah, myasthenia gravis is what it sounds like from the limited information that you have currently. Could it be something else? Sure. Could she just be imagining her double vision and telling you she has double vision, but really she doesn't? Sure, that happens all the time in the emergency department. But take the information you are given in the question stem for, give it the benefit of the doubt. They're not going to be telling you things that are just, patently untrue. And as far as diagnostic tests go, say you're down to a CT of the brain, serologic testing for stimulatory autoantibodies, or administer a drug at bedside and monitor for therapeutic effect. What do you guys think? A, B, or C? CT of the brain, serologic testing for stimulatory autoantibodies, or administer a drug at bedside for monitor for therapeutic effect? Silence fills the room. I'll speed through this. So basically, in the emergency department, I can only do one of these, and I'm probably going to CAT scan the brain. But given any possible option, administer a drug at bedside and monitor for therapeutic effect is going to be the correct answer. Yes, this is a very outdated test. Yes, it's not even available in the United States anymore. I'm referring to the edrophonium test, by the way. But of the 3 answer choices, it is the best one you've got. And step 1 will frequently test you on outdated diagnostic modalities as well. And serologic testing for stimulatory autoantibodies, the trick is in the stimulatory, because these are anti-ACH receptor antibodies. Stimulatory might be referring to, for example, Graves' autoantibodies. I'm going to skip that question over there. So scores and passing rates. Passing is 196. The mean is 229. 20 points is 1 standard deviation. Some of this information is kind of besides the point now. Now that we're in the era of the pass-fail step 1, you only have to worry about this to a certain extent. It is important to know, though, that of allopathic medical students, about 96% pass on the first try, 99% eventually pass. Osteopathic medical students, 95% pass on the first try. That's actually not a huge discrepancy. And of IMGs, about 78% pass on the first try. Here is kind of the breakdown of who passes, who fails. So here's the minimum passing score. As you can see, it's about 5% who don't pass that first time, and the curve sort of scoops upward from there. Now we come to a section that we used in our slide deck in years past, defining your goals. But maybe at this point, it's more important to talk in general about step 1 going pass-fail. And if you have any questions about this, type them in the box. Jeff, if there's a certain question that comes up about this change to pass-fail, if it comes up over and over again, please let me know so I or one of the other panelists can address it. So January 6th, 2022, which has come and gone, the USMLE, it transitioned to pass-fail only reporting. The passing standard increased by 2 points from 194 to 196. And the CBSEs and CBSSAs will no longer report a 3-digit score starting on February 23rd. They will report on the overall percentage correct and provide an estimated probability of passing USMLE Step 1. Comlex will similarly be going to pass-fail in May 1st of 2022. So what does this mean for you? Well, it means that a certain amount of the pressure to crush Step 1, to really gun for it, is going to be taken off of you. It means you can tackle your first 2 years without the test-focused mentality of get to the board relevant point. You can actually learn stuff, which is kind of cool. What it shouldn't mean, though, is for you to basically blow this off, especially for you good test takers out there. Now, I do want Brenda and Brian to chime in on this one, but here's kind of how I look at it. Your preclinical years are a truly unique opportunity to really where you really just have all your responsibilities is to sit your butt down and become as smart as humanly possible, to acquire as much raw medical knowledge as you can, to become an amazing, amazing physician. You are never going to have that time again. Your clinical responsibilities are going to increase gradually and gradually. Clinical years, you'll find that you really don't have as much time as you used to sit with a book and study. You have to kind of squeeze it in bits and pieces. It's not nearly as effective in my case. And as a resident, it gets even harder. And as an attending, nobody's breathing down your neck to stay on top of things. So people get lazy. The point is, don't blow off step 1. Don't blow off the utility of building up your fund of knowledge as much as humanly possible. This is not an opportunity that many of us get again. Brenda and Brian, you want to weigh in?
Sure. So I'm currently in year 3. So I recently wrote step 1. So let me tell you, as soon as you start clerkship, you're going to be so busy. You're going to be wanting to learn the clinical skills because that'll help determine if you honor, pass, fail. So you won't really want to, you don't have much time for studying. You're really trying to learn how to take what you learned in years 1 and 2 and apply it to the clinic. And a lot of the preceptors like to know that you understand your basic pathophysiology. They don't want to know that you just memorized a bunch of facts. Like a lot of times they'll ask you the why question. So why do we do this? Why this medication? Why is this patient developing this? What side effects would you expect? A lot of whys. And given that you don't have as much time studying, you don't want to burn out either, building up that foundational knowledge is just such a good skill. And the study habits you develop, like so for RX, they really taught me how to be effective with my study time. And a lot of that is applying now because I'm trying to maximize whatever time I do have to study. So it's just such a great opportunity to learn, just kind of like echoing what Arjun said, like you don't get this opportunity very often. And a lot of us, we're in medicine because we love learning, so why not take advantage of it?
Yeah, I mean, really, the switch to pass-fail, the greatest benefit in my mind is to allow you to sort of shed some of the stress of test taking for residency placement's sake, and allow you to learn because it's worth doing, and learn because it's freaking fascinating. I mean, all my family is in business, and if I sat in a cubicle all day long, I would just about die. So yeah, the stuff I'm learning is freaking cool compared to the Excel spreadsheet stuff they do. Brian, you have anything to add?
Sure. I would just say that, just because it's pass-fail, I think it does take a little bit of pressure off and allows you to have a little bit more fun with learning. And just remember that, the skills and information you're learning, they continue to build. You're learning how to think as well as learning the foundation of your medical knowledge that will carry with you throughout your entire training. So it's important to build a good foundation, because even now, in my intern year of residency, I'm almost get a little sick thinking about how many times a day I have to talk about a nephron with my colleagues, or the different co-transporters throughout the nephron. So all this stuff matters as you advance through training. And I'm training to be an ophthalmologist, which has nothing to do with the kidney for the most part. So just do your due diligence and build a strong foundation, and it'll help you throughout your whole career.
Choosing study strategies. So some of this will be based on your learning preferences, some based on the structure and characteristics of each subject individually. Some is based on your curriculum. Probably some of you know the professors that will focus very heavily on their one particular topic of interest, and in doing so sort of, not teach you the scope of what you really ought to know for, to be a doctor. And so some of how you study will be dependent on what your school's curriculum is, and the amount of time assigned to a particular subject or system. Let's go over some of the different subjects or organ systems, and let's give a couple tips for each. So anatomy. So probably many of you spent a lot of time in the anatomy lab, and it was pretty overwhelming. So your first subject, we were trying to learn literally everything. And most of you have probably learned by now that on step 1, anatomy is typically fairly low yield. Anatomy is important for specific diseases, traumatic injuries, procedures, and common surgeries. Certain types of anatomy are reasonably well tested, especially compared to the amount of attention they get in your traditional curriculum. Neuroanatomy, fairly highly tested, as makes sense, right? Because clinical diagnosis of neurologic lesions is, at least in part, dependent on whether or not you understand where in the brain a certain lesion will produce certain outcomes. Embryology, reasonably high yield. Basic cross-sectional anatomy, can you identify this on CAT scan or X-ray? And of course, you're not expected to be radiologists, but there are going to come times when you are asked to identify structures on X-ray, and your knowledge of anatomy is important in those circumstances. Biochem. This is crammable. There's a lot of little tiny factoids that you probably didn't learn biochemistry as a series of factoids, but that's probably honestly how it's going to be tested. You're not going to be tested on whether you can regurgitate an entire pathway and how it intersects with the other pathways. That's how I learned it because I was a biochem major, and I think it helped me remember. But quite honestly, I mean, this subject really is fairly crammable. Also be familiar with medically relevant laboratory techniques. Micro and immunology, also crammable. Lots of little tiny factoids that you can memorize in a bubble. These are great for flashcards. My God, are they great for flashcards. 40% is focused on bacteriology, 25% on immunology, 25% on virology, and 5% on parasitology. So, I know bacteria are everyone's favorite thing because we've got so many antibiotics and can do so many things about them, but don't perseverate on bacteriology. Focus on the distinguishing characteristics, the target organs, the method of spread, and the diagnosis. Know the immune responses. Know which patient populations are susceptible to which infections. Know what vaccines are available. The sort of clinically relevant stuff that you might expect your average doctor should know. And for viruses, you should know the viral structure and genome. That's one thing that kind of breaks the rule there, because this is how viruses are categorized. That may not be something that is particularly relevant to life as a clinical physician, but that is something that they're going to be testing you on. Of the wide world of bacteriology and parasitology, think of what is going to be clinically relevant. Pathology. Okay, this is it's a huge but important topic. 4 different diseases, know the signs and symptoms, know how to almost automatically, reflexively pick up on a diagnosis based on certain keywords, like the myasthenia gravis patient. Be able to sort of link those quickly in your head so that you are able to move on to the next step. Because, like I said, it's usually going to be multi-part reasoning. And finally, you're going to see a lot of pathology slides. If you hate pathology slides, that's actually not a huge deal, because most of the questions with, pictures of photomicrographs can be answered with the question step just by itself. Farm, crammable. Tons of I have a Arjun's rule of studying. If Sketchy makes videos of it, then it's probably crammable. Or if Sketchy makes good videos of it. I think Sketchy Path is not the best, honestly, but for Farm and Micro, Sketchy does the trick. But you focus on prototypic drugs. If there are obscure derivatives, for example, of the 15,000 different antipsychotics, remember the important names. You don't need to know the trade names. So for IMGs, you can breathe a sigh of relief. We're going to be focusing on generics. The major categories that you really should spend some time on are drugs affecting the autonomic nervous system, the central nervous system, the antimicrobials, especially the antibiotics, the drugs for the cardiovascular system, and I would say to a lesser extent oncology. I mean, Brenda, Brian, maybe weigh in here. I mean, onc drugs were never tested like crazy when I was studying for Step 1. Has that changed?
I had a few questions on them, but then again, it was mostly like a lot of the times they give you a vignette of a patient experiencing a side effect. What is the drug? Or they'd say they gave a drug which acted in which manner. So that's kind of how it was tested, but yeah, it was pretty up there.
I mean, I guess all I was trying to say was not to the extent of, autonomic nervous system, central nervous system, antimicrobial, cardiovascular. To me, oncology in that group stands out as like not especially high yield.
Okay, I see what you're saying. Yeah, compared to other drugs, it's not super high yield. I would just know some of the main ones like methotrexate, the cisplatins and all that, but like not crazy, crazy detailed.
Mm. All right.
I would agree with that too.
Cool. Know the mechanisms of action of the drugs and know the toxicities. And review the associated biochemistry, physiology, and microbiology. Not necessarily because you'll be tested on those every single time, but it's a good way to cross-link your knowledge. Remember, I mean, these vignettes are not going to go system by system, and they don't follow the organization of the topics you're studying in. They are going to be, I mean, it's going to be kind of a mishmash of stuff. And pharmacology is a great opportunity to sort of try to link your knowledge between biochemistry, physiology, and microbiology. Physiology, this covers a huge range of organ system stuff. It's concept oriented. They may test you on diagrams, but it's also important to understand and visualize the diagrams, like the pressure volume loop, for example. It's a different thing to kind of know how it looks than it is to be able to understand what happens when the curvature changes in the graph, what each phase represents and means, and how they can all be altered. I am a big believer in physiology diagrams and understanding kind of the different permutations each diagram can take. Not everybody is, but I think I think these really help with understanding a concept. And many clinical vignettes incorporate pathophysiology as well. On to some of the organ systems. Psychiatry includes psychology, sociology, psychopharmacology. Some of the high yield stuff includes personality disorders, psychosomatic or somatoform disorders, substance abuse, and eating disorders. I'm surprised that depression is not listed here. I mean, I think, you know, on the DSM-5, honestly, there's tons of lists of criteria you could memorize. I would say there's only a handful that of diseases where you really ought to be memorizing, you know, criteria point by point. Like a depressive episode is one of them. Schizophrenia is another, and a manic episode is another. And I would say that, you know, for the rest of them that have, you know, where most psychiatrists may need to sort of check boxes to and memorize every specific criterion, I would say for step one, you know, you can mostly go based off what is the best answer and pattern recognition for a lot of them. And what do you think, Brenda and Brian? Agreement is all right too.
Yeah, I would say I agree with you.
Telling me how smart and awesome I am is also cool, even if it's a lie. Oh, you gotta entertain yourself. Public health. Okay, so here we go. So this is a mix of biostats, epidemiology, ethics, law, healthcare delivery, patient safety, and quality improvement. So this is where I found the biggest discrepancy between the focus it was given in my medical school and how important to both step one and even more so real life it actually is. So biostats is not traditionally something med students enjoy studying very much, and probably a lot of this public health stuff. But honestly, spend the time on it, man, really, because this is going to be what you live and breathe. You're going to see diagnostic test results all the time that give you kind of an equivocal answer, where the diagnostic test result conflicts with the clinical picture, and you're going to have to decide what you do. Urinalysis, for example, it's not always going to be as straightforward as, oh, patient has burning pee and tons of pus and tons of bacteria. There's tons of equivocal urinalysis results. So, and there's tons of contaminated samples. So some of this stuff like biostats, epidemiology are tremendously important to learn, even if your school did not spend a ton of time on it. Things like law, healthcare delivery, patient safety, quality improvement. A lot of these are very important, not just in clinical practice, but if you want to get into healthcare leadership too, which many of you may. And ethics, you know, there's always the question of how effectively can you didactically teach ethics? And the answer is there is always a patient situation that will surprise you. But if you have a set of scenarios already in your brain where you kind of understand the acceptable answer, well, the more of those you know, the more of these scenarios you've run through, the less time you have to spend at the bedside hemming and hawing over something that is ethically difficult, and less time you have to treat it like it's really new. So that's my take on public health. A lot of curriculums don't do this justice, but I would absolutely spend time on it. And review resources. You have your text reviews. That is for you have your primary learning tools like the RX bricks, like your textbooks. You have your text-based test prep resources like First Aid for the USMLE. You have question banks like QMax, like UWorld. You have self-test reviews, case-based reviews, review courses, and then you have all manner of other stuff like flashcards, videos, and mobile apps. Can I ask the panelists real quick, I'm sure it's interesting to hear what sorts of stuff you did specifically, but if I know anything about medical students, is that y'all got a mad case of the FOMO, which is if a really smart person says, I use this, this, and this, a ton of you medical students are going to go, well, now I have to do this as well. So instead, I'm going to ask you, what did you learn most during the process of studying for Step 1 and then actually taking it about what resources to utilize and how to most effectively use your resources?
So for myself, I kind of did exactly what Arjun said. I ignored everyone because it would cause me so much anxiety when I heard people were like doing 2 passes of UWorld or listening to the Thoma, and it would just freak me out. With myself, I found doing Anki every day, just like that sort of spaced repetition, having a good routine, and Q-berries were kind of my go-to. By the end of studying, I'd done over 12,000 unique questions. So I didn't do 2 rounds of UWorld. I just did as many Q banks as I could, and that's how I learned, because I knew if I could apply the knowledge from there. And I actually used a lot of Arjun's videos studying, so this is kind of weird being in a panel of him, but yeah, thanks, Arjun.
As you can see, I'm not actually that smart in real life. I script everything so I sound smarter. Yeah, but oh my God, I totally echo what you're saying, Brenda. I mean, I think that honestly, the more you let other people get inside your head, even the really smart ones, the more you're going to make yourself miserable and the less effective you're going to be in studying. Because if you guys take one thing away from this, just take away the fact that everybody is going to do something slightly different. But at the end of the day, you got to exercise some self-awareness and know what sorts of stuff works best for you. I'm a reader, honestly. I mean, I know I do a lot of videos and I'll watch them occasionally, but I'm a reader. I like to engage with the information, draw really colorful notes in like 8 different colors of gel pen, map out a pathway for myself so that I can convince myself that I know how it works. And most people really don't study like that. Most people just hit the Q banks hard. I also, Brenda, like you, use flashcards, partly because, there are crammable facts that you really just have to sort of memorize the bullet points. And for me, that was a good way to get my exercise in. I'd spend an hour on the treadmill in the morning and just crush some flashcards during my dedicated time. But the point of this is not to say do what Arjun does, because Arjun's the greatest, because he's really not. He's just pretty regular dude. Do what has worked for you and stick to a plan. Don't let everybody else, you know, convince you that you're missing out by not doing something. Brian, any tips on this?
Yeah, I would say that it's important to be mindful that, you know, if you're in a position where you're taking step one, you are smart. You're smart enough to be there. You've already passed a lot of the hard steps to get into medical school. And it's about finding what works for you. And sometimes the quality of your studying is a lot better than the quantity. And by that, I mean you can get caught up using 100 different resources because all of your colleagues are using them, when really maybe it's better for you to just go through a handful of resources and spend the time learning through them. I think it's a good time to really learn how you like to learn, and do your best to try to maximize that.
Yeah, absolutely. I would even go so far as to say, I think quality is almost always better than quantity. I think that people obsess over getting through X amount of questions or X amount of question banks. But if you're just trying to plug through the questions just to do them, just to check them off, are you spending any time reviewing? Are you spending any time understanding why you got something wrong? Are you spending time on the questions you flag because you're kind of guessing at it to learn, oh, I got it right, but what should I have known to be more sure of this? What is, you know, what led me to the correct answer, and what lessons does that teach me about test taking strategy? Are you actually thinking through all those things, or are you just crushing questions because you have to get through 3 question banks? I don't know, I just made a number up, whatever the kids are doing these days. And it's time for another poll question. All right, Jeff, that's your cue. Jeff's fallen asleep listening to me talk. What resources will you likely use? Choose all that apply. Question banks, review books, flashcards, mobile apps, videos. This is a check all that apply.
And Arjun, one thing I wanted to note, we just dropped a link into the chat if you're looking to see the top rated review resources. We have it just posted about a month ago, and this was based on the survey of students who took step 1 last year. So again, looking for good unbiased reviews, you can hit there.
All right, so just about everybody is using a question bank. Just about, or most people are using a video resource or a review book and flashcards and mobile apps are kind of dragging behind. All right, this is pretty consistent with what I experienced. Gosh, I feel even weirder as one of the odd people out for not really using videos that much. I was a book guy, but again, you know, you do what works best for you. All right, study tips. So forget the FOMO. Here's what I would do. Establish a study schedule and stick with it. Don't keep changing course. Stick with your study schedule. Integrate and apply everything. Save the crammable subjects for the end. Focus on high yield material and previously learned material. Stuff that you can reinforce, make sure you really know it. And allow in time to schedule breaks, exercise, and deal with your personal stuff. I would love to imagine that all of you, have your lives so in order that none of you has any, stuff going on in your lives that's causing you personal anxiety. Be real with yourself. If you've got something you need to take care of, if you're an exercise freak like Brenda and like to do wind sprints up and down the hall in the middle of your USMLE, know that about yourself. Keep exercising. You're gonna feel weird if you don't. I did, during the periods of time when I didn't exercise. I felt super weird. So even during my dedicated, man, I made time for that. You want to be at your best. Stay relaxed and grounded. It's a lot easier said than done. Hopefully, with step 1 switching to pass fail, this will be a little bit easier for some of you guys. Instead, focus on this as an opportunity. Think of this as your chance to become as smart as humanly possible before clinical responsibilities take all your time away. And use our checklist to keep you on track. What checklist are we talking about, Jeff?
Well, we do have our study schedule, and there are obviously a number of items there on that bonus page on the First Aid Team blog.
Oops. CBT tips. Jeff, I am so sorry. What does CBT even stand for?
It's computer-based testing.
Okay, got it. Cool, acronyms. So yeah, understand how to use the computer interface before you dive into it. The practice tests that you get from the USMLE website, as well as, you know, the RX QBank and UWorld will be reasonably high fidelity. You should try to, you know, take that tutorial seriously, the one that's at the beginning of every test, because you do have time allotted for it, and it does help to sort of check and see that everything you thought you knew about the interface is actually correct. It's a pain in the butt to have to learn that partway through the test and have that be just one additional stressor, honestly. Know the keyboard shortcuts, and mix Q&A throughout and at the end. I don't know what that means. I'm gonna skip it. Here is a study. What does it mean? Test them a week later. The most effective study method combined 2 study sessions with retrieval practice. All right, I guess it shows that spacing out your learning, your primary learning, aka reading and videos, etc., is most effective when it's spaced out with some active learning, retrieval practice. And that's pretty consistent with adult learning theory, which posits that as adults, we retain stuff when we are convinced that it has relevance. Cool. CBT practice options, USMLE sample test. Okay, this is probably going to be the highest fidelity. Commercial, and it kind of ranges all the way down to commercial test banks like QMax and UWorld, where you really just, I mean, those Q banks are pretty vast. You're going to be able to get in your reps and cover a broad base of knowledge with those Q banks. More research. Q banks are better than flashcards. I mean, sure, but I would say you use them for different things. Like, for example, I'm not going to do flashcard after flashcard on cardiology, but I might flashcard stuff that I keep getting wrong. So I don't know, I'd take that one with a grain of salt, to be perfectly honest. You probably know the things that are flashcardable. It's like your little micro and farm trivia, as well as the little factoids that you keep missing no matter how much you study them. 285 to 445 multiple choice questions is equal to, yeah, again, you're probably not going to be as point by point focused, to be honest. Blah, 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 blah. Okay, well, you can read that. Test day tips: less coffee on test. Oh man, I'm such a bad example for this. What? Can anyone tell me why you would drink less coffee on test day? I would drink the same amount of coffee, to be honest. I mean, I just personally, because if my body is getting less caffeine than it's used to, which is a lot of caffeine, then I'm gonna feel weird. My goal in all of these circumstances is to practice in an environment that is as similar to test day as possible, and try to test in my most comfortable state. Is that a general bit of advice that resonates with the two of you, Brenda and Brian?
Yeah, I agree. Whatever you did on your practice test, you should do on the actual test, because then that's what you're used to and accustomed to. Your body will be in shock. Like, I drank coffee like I normally would, kind of like Arjun. I'm a coffeeholic, so it's all good.
Yeah, I don't know. I wouldn't really adhere to any prescriptive advice on how much coffee to drink or how heavy your lunch is allowed to be. Just do what you normally do. You don't want trying something weird out to screw with your rhythm, because you're going to be stressed enough. You've got enough things to focus on. Just do what you normally do. Done.